Good morning, everyone. We got it right the first time. So welcome, Sara and Mark.
Thank you.
Live streaming on Facebook. I didn't know you can do that through Zoom.
Oh, should.
Yeah, sorry, I'm hearing something in the background. But anyway, we are super happy to have you here. Today is part of the many events that we have organized for infant and pregnancy loss awareness. October has been a big month for us. And we are really trying to create this resource for our community, which is the Bumpwise community, and actually for anyone who is able to access Facebook. And we will have these videos available for moms to learn about different modalities that can help them overcome the loss and grief that they suffered with their miscarriage, with their termination, with their infant loss, and so on. And today we're addressing the physical. So we've had a little introduction on how doulas can support loss as well. We've had a really great session last week where we talked about Reiki and body talk and how these modalities can help. And today we're addressing the physical. We're going to get physical, and Sara is going to talk about osteopathy. And we have Mark here, who's a very experienced TCM practitioner. So he will talk about the different modalities within TCM that can support this kind of situation that you might find yourself in. So as always, mummies on the call, feel free to ask questions, put them in the chat. That might be easier, and then I can read them out. And we'll start with Sara and Mark introducing themselves, and then we'll have some presentations to share as well. Sara, do you want to go ahead and introduce yourself?
Yes, okay. So my name is Sara Bailes. I'm an osteopath. I trained at the University College of Osteopathy in London in, I think I graduated about 21 years ago now, in 2002. I am a mum of 2 grown children now, although I have had 5 pregnancies, which I will at some point while I'm chatting go into that because it's relevant in this particular setting. It's not something that I would usually share, but I think it's relevant here. So I am originally South African, but I married a Singaporean many, many years ago and have now become Singaporean myself. My children are Singaporean, so this is home. Our clinic is located in Tanglin Road at Ammo Clinic. We find a very convenient location. There are 2 of us in our practice, myself and Anna Mackay, and we focus primarily on women and children, babies, but we do often treat the whole family.
Amazing. Thank you, Sara. We'll hear a little bit more about you in a minute, but Mark, can I ask you to quickly introduce yourself?
Definitely. My name is Mark. I run SOMA Clinic. SOMA Clinic is a clinic catering to women looking to conceive. And we also treat pregnancy and postpartum, which is why we're in your show today. We actually work at arm's length, but quite closely with Ammo Clinic. Ammo Clinic does very good, soft, gentle work on the musculoskeletal system. And yeah, we have sent pregnant women over to Ammo because osteos have this amazing touch, their hands. At our clinic, most of what we do around pregnancy is with threatened miscarriage, breech, and also postdates. And I'm here probably because we do get women going through miscarriage and recurrent miscarriage.
Yeah, amazing. Thank you, Mark. I've sent a lot of clients to you over the years for what you said. Breech babies, always an issue. Moms being threatened with induction and wanting to avoid it desperately. And you help a lot of them. So thank you very much for that. And Sara, if you would like to screen share, we'll go right into what osteopathy is and how it can support. Do you want to screen share?
Yeah, I'll do that now.
Thank you so much. Amazing.
Okay, so we've already talked a little bit about me and who I am and the fact I'm an osteopath and so on. So we're often asked actually what osteopathy is because it's not as common here as it is in somewhere like the UK where I trained. So osteopathy is a form of treatment, a healing treatment that improves the health both physically and emotionally via the musculoskeletal system and the nervous system. We do this, as Mark said, hands-on. It's a manual therapy, which means we use our hands to treat, to diagnose, and in fact, to then assess the outcome of treatment. It's suitable for any age. We treat from newborns all the way up to the very elderly. And we have different modalities of treatment, different tools in our toolbox that we would use depending on who's presenting to us, the age, how frail they are, how little they are, and so on, which I'll talk about in a minute. Just to give an idea of what to expect when you come to an osteopathic consultation. So in your first consultation, we would take a very detailed case history. This is because everything that's happened to your body in the past is going to have an effect on how it is presenting to us today. So we would ask about your past accidents, hospitalizations, any medicine you might be on, any ongoing medical issues, like if it's diabetes or Hashimoto's or something like that, any operations you might have had, and so on. So it's a very detailed case history with a lot of your medical information coming in there. So at this point, I can say that confidentiality is at the core of everything we do. So obviously, you know, when you're sharing something like that in your case history, confidentiality is super important. But also what it does is being bound by this confidentiality creates a very safe space in our treatment room for whatever else might come up during the treatment, what you feel like sharing, or how the treatment is going. It's absolutely confidentiality as core. Mm-hmm. So during this first treatment, after your case history, we would do a physical examination. We might ask you to do some movements where we would be assessing the function of the body. We would then have you lie on the treatment couch and well, we would perhaps have put our hands on even during that physical examination. We would continue the examination lying down, perhaps with more passive movements. During this time, we'll also be explaining communication is very important to me as a practitioner and to most osteopaths and practitioners in general, I would say, that we explain and communicate with our patient throughout the consultation, what we're looking for, what we expect to find, what we do find, how we expect it to work out, what kind of treatment plan that we put together with the patient, and what they can expect. We also would offer advice and perhaps some exercise if it's necessary or appropriate for the patient to go home with. And this can be very useful for patients to feel that they're in charge of their own health, that when they go home, they've got something that they can continue doing that continues the work that we've started in the treatment room. Our treatments are 30 to 45 minutes. Another great thing about osteopathy is that you get to spend a fair chunk of time with your patients. This allows you to get to know your patients well, your patients get to know you, and there's a rapport that builds up and a confidence in your practitioner, a relationship. And whilst we go through, especially something like this, when we're talking about such a deep topic, patients do feedback that they feel the time they spend with the practitioner is beneficial in them releasing, opening up, dealing with the pain and grief that comes along being released at the time of manual therapy that we're doing. Mm-hmm. The number of treatments we do is on a case-by-case basis. Every treatment is completely individualized. Somebody might be able to have complete resolution within one treatment. Other people, it will take a number, and some people come for maintenance care. In my case particularly, I do have a fair number of patients who come regularly because of the type of treatment I give and the amount of stress relief that it gives them just for things that are happening in their daily life. So they might come every time they're just not feeling so well. They don't necessarily have to have any physical body aches and pains. Mm-hmm. Before it gets there, they'll come and see me. So the type of tools, we call it sometimes, is that we have in our toolbox, the type of hands-on treatments we do are very gentle and non-invasive for the most part, but we also do go towards some techniques where you might put the body through a very high velocity thrust, and we hear that little click to release a joint. But a lot of our techniques are soft tissue release. That would be some forms of massage, stretching, muscle energy techniques to release of soft tissue. Articulations where we're getting the joint to move better. If something is a bit stuck, often when the muscles are tight, they pull in together, the joint gets stuck. And so working with both the joint and the muscles will help in the long-term release of that area of dysfunction. The manipulations I was talking about, those very gentle or quite, they don't hurt, but you know, you hear a little click or pop when we put a little bit of force through the joint. This is something that we will always ask for permission with the patient, you know, for consent. Some people don't like this at all, and we will never do it. And, you know, some people love it. Some people, a little bit of both. If it's necessary, they're quite happy to consent, but it is a discussion with the patient each and every time. It's not like once they've said yes to it, we'll do it, you know, in subsequent treatments without verbalized consent. Mm-hmm. We also have visceral techniques, which are very beneficial in various ways for various reasons. And it's not something else that we might pull out of our toolbox if we need it. And then we have cranial osteopathy. This is something that you can see in the slide that I've shared. It might be where we're holding the head just beneath the neck. It might be on top of the head. It might be down at the sacrum. And this is a very deep form of healing. You might feel that we're not doing very much, but in fact, patients will invariably at some point have this very deep breath and a very big exhale, and can suddenly feel the energy and the flow through the body better than before. They'll say that they can breathe more easily, and they will get up and walk out of the room with far more energy and a release of stress than they did before. During this treatment, patients will often fall asleep because it's deeply relaxing, and it brings the body even more into that healing phase. I'll talk a little bit about that later, but yeah, so that's cranial osteopathy. Mm-hmm. When we go in to talk about the specific topic that we are talking about today with pregnancy and infant loss, it's important to just realize that our physical bodies are manifestations of our emotional state. They don't exist independently. Emotional distress can be expressed with physical symptoms. So that's more what we're going to talk about today. But I can also, you know, go into how when we're treating the physical body, the physiological body that's been affected by emotional distress will be affected. And when we release the physical body, we have an effect on the physiology, which has an effect on the emotional response. So I'm going to explain it more in simple terms. If we just talk about how we see emotional distress in a patient, we as practitioners are quite skilled at seeing what somebody is going through or dealing with just as they walk into the room. And this is seen in their posture. Very often somebody who is in grief might have what I kind of call a closed posture. Their diaphragm is tight, they're shrunken forward, their shoulders are up, their chest is closed, their head is down. Somebody who's stressed might come in and, you know, that sort of way. So the posture tells us a lot about what is possibly being expressed physically that could have actually an emotional basis. Then the breathing and the heart rate and muscular tension. These are all things that we can understand very well, how emotional distress can be causing those things. If you're angry, if you're stressed, your heart rate might be increased. If you're holding grief for a long period of time, your diaphragm gets tighter and tighter and tighter. And eventually you are hyperventilating. You might be getting a lot of headaches through the muscle tension that's up in the shoulders, or just through the hyperventilation, the increased in, CO2 that's not being released through proper breathing. And obviously, again, the muscle tension. So I want to use the diaphragm as a particular example of physical release of emotional distress, because the diaphragm is a big muscle. It's our big shock absorber. And it's where often this holding of pain or grief or stress can be centralized. It's almost like in our solar plexus as well. That's where people, feel that they're holding the grief. When you've had a terrible loss or suffering, ongoing grief, especially at the very early stages, you might feel that there's a hole in your stomach and like you feel sick, you feel like literally a hole, and that you can't breathe. So obviously you are breathing, but you're using your upper respiratory muscles, and your diaphragm is just getting tighter and tighter and tighter. So an example in simple terms that everybody can understand of how I describe this is, imagine you're about to have a car accident. But hopefully you don't, and you manage to right yourself. But as you're about to have this car accident, your whole body goes in and up, and your shoulders go up, your neck is tight, and this posture gets held for quite some time. Hopefully, if you're a young, healthy, individual, that stress can dissipate quite quickly. But often, and especially as we're talking today about grief and loss, that holds for a long, long time. Often we don't want to release that grief. We want to hold on to it for reasons of not wanting to forget or let go of our baby, or that we were carrying, but it doesn't serve us. And by releasing the diaphragm, working it through, stretching it out, working through the rib cage, through those upper respiratory muscles that have now become tight, opening up the body, dropping the shoulders, releasing the neck, and putting the body back into that more functional posture, the patient will feel calmer, better able to approach the world, easier to deal with the other stresses of everyday life, which might be work, might be young toddlers at home, etc. When they are in the initial state of grief and so overwhelmed and all wound up and tight, you don't have enough compensation to deal with everything else. And just by simply putting the body back into a functioning physical state, we can affect how they deal with the world emotionally.
Yeah, and that's why I find the physical healing modalities so helpful, because sometimes I don't even want to talk. I can't talk. I can't find any words for what I'm going through. But you as a skilled practitioner will feel what is going on and can release this without many words needing to be said.
That's true. That's very, very true. This happens even with other patients on the table. You might be dealing with something completely different because of the body's incredible ability to compensate. They might have come in with a sciatica or something completely different, but you end up treating at the top, at the shoulders, because that's the original point of possibly what started this pain that they might be coming in. So it's true that we are able to feel where that pain is. Sometimes I've had patients where I feel that there's tightness in the diaphragm, and I go there, although they've come in with something but possibly not non-emotional, and I put my hands on their diaphragm and start to release it, and tears start to well in their eyes, and just little tears start to run down on the treatment couch, and sometimes they are quite shocked actually at it, and we can reassure them, and then sometimes get to the bottom of why they might have had that emotional response from the diaphragmatic release. So in the case of infant loss particularly, we'll often treat, well, more often than not, treat the sacrum and pelvis, because whether a woman has gone through pregnancy to whatever stage, or how she possibly needed to deal with the aftermath of a miscarriage with internal evacuation or something like that. There, even just with pregnancy, there is that change in the pelvic area in the woman's body, whether it's in the lumbar spine, the lordosis, depending on the level of pregnancy, the relaxin that comes in, loosening off the ligaments. So that area of the body physically is an important one to treat, but also when we've had loss, miscarriage, infant loss, we tend to hold the emotional aftermath of that in that area, in those tissues. And so working cranially on that area or into the ligaments and muscles around that area can be very important in releasing off the pelvic floor and so on. So as I've said, so most of these modalities are quite physical and lead essentially to increased blood flow and to promote relaxation in an overall way of the body, which helps deal with how the woman is feeling emotionally. With osteopathy, it's most people, a lot of people don't know this, but my patients who do and do refer, it's normally a word of mouth thing. It's important to know that you don't need to have physical pain to come and see us. As I said earlier, a lot of people do come and see us because they are neurologically in a heightened state that they want to calm. And that osteopathy is a very good practice to, there are lots of other ones as well, but to release and to calm down the autonomic nervous system and put the body back into, out of a state of fight, flight, fright, and into a state of rest and relax, where the body, as I was saying before, can cope with daily life and things like that, but also with better functioning in the physiology of the body, which has greater health benefits more widely. In our clinic, we do offer home visits, which I just wanted to point out because with infants, this can be very helpful. But when women have gone through loss, quite often they are unable to leave the home in quite an overwhelmed state. They might, make appointments and cancel them because they don't want to leave, that sort of thing. So having home visit options where our patient is feeling calm and comfortable can be quite useful. I've talked already about confidentiality. Continuous care is another thing that's wonderful about osteopathy, because we treat women before they're pregnant, through their pregnancy and fertility journey, whilst they're pregnant, postnatally, and we also will very often see the babies, whether that's for well baby checks or there's something that needs intervention in an osteopathic way. We have that lovely continuation of care because it's helpful because we know our patients. So say, for example, we're treating a woman who's had multiple miscarriages and has been struggling with her fertility journey. When we start to treat them when they are pregnant and the pregnancy is progressing at what we'd consider, normal milestones and everything is going well, she herself can feel fears and concerns and worries, and symptoms may sort of come to her that she feels are there because she's reliving post-trauma, and she's feeling very anxious. And coming to see us and having that reassurance that actually everything is going okay is helpful for her. But also the fact that we are understanding of how this manifests, understanding of her past journey. But even if it's a new patient who's come in, we are very aware of how past experiences can be affecting the current situation that we are finding ourselves in.
Yeah, even unconsciously.
Yeah.
Mm-hmm.
So, if we've got time, I don't know how much time we've got, but if you would like, Johanna, I can share a little bit about what helped me in my pregnancy loss.
Yeah.
So I've had 5 pregnancies and I've got 2 live children. So my son, I think I said, was 20. My daughter's 22. They're both off at university. So this was a long time ago. And I would like to talk specifically about my first and my last pregnancy. So my first pregnancy didn't progress beyond 6 weeks. And without going into too much detail, this was something that was kind of my fault. Legitimately, I mean, honestly, because I didn't share enough with a practitioner that I was seeing, and he didn't ask, and in any way, so on. So it was quite early in the pregnancy. So I then, after that, managed, I had to have intervention because I didn't spontaneously miscarry. But after that, I went on to have my daughter and then my son and my live children. And I think I just brushed it on the carpet. I didn't really think much of it, honestly. After that, there was another pregnancy that didn't go right, but that was a different situation. And then my last pregnancy, which was my baby Amy, that you see on the screen here. So Amy died at 20 weeks in utero. This was just before her 20-week scan, and obviously, when you have to actually have a cesarean section to deliver your child, it was really considered a late pregnancy, but for me it was an infant loss because she was, she was a baby that came out that, anyway, it's always a little bit difficult, sorry, when I get onto this, but anyway, so it was after I did process Amy, I went to lots of different treatment modalities, and I've got to say that I was grasping at straws in the dark, trying to find lots of places to go. And that's why I think it's so wonderful that what you're doing here is putting it forward in a very clear way, the different treatments that are available to women who are going through something like this. Because I didn't know, and even when I was trying out a therapy or a treatment of some sort, I didn't really know that they had a sort of a specialized, but they had a definite way of treating infant loss and grief. So that I have to say, and I did deal with that in the best way that I could. But then what happened to me, I was years after Amy, I had terrible back pain, and I was seeing an osteopath for that back pain. And he is primarily a cranial osteopath. And it turns out that he brought up and found that I hadn't processed the grief and the guilt of the loss of my very first pregnancy. And even as a trained osteopath myself, I was shocked.
Yeah.
How dealing with that at that very late stage truly helped me to get to a position where I can talk about it without crying too much, although my voice may shake a little.
Yeah.
Also at this point, I'd like to share something very profound that a friend of mine that happened in my healing journey with Amy. Now back to Amy. During the aftermath of that, when I was still in very much waves of grief, I mean, you know how it comes, sometimes it just hits you in the middle of the supermarket when you're looking at the nappies or, something. I was in the car waiting for my kids to pick them up from school, and a friend called to talk about something completely unrelated to anything to do with children or infants or anything. And I burst into tears and had a wave of grief and was sharing with her about, I can't cope or whatever it was. And then I apologized to her because I said, I can't be complaining about this to you because you've had a loss that is far more significant than my loss, because she had actually lost a toddler. Yeah. And I said, I shouldn't be complaining to you because your loss is so much worse than mine. And she said something very profound that I want to share with everybody on the chat or whoever listens to this, is that she said to me, my grief was the worst thing. Well, what happened to me was the worst thing that's happened to me. And what's happened to you is the worst thing that's ever happened to you. So our grief is equal.
Yeah, thank you for sharing that, because I think we've heard that so many times in the sharing circles as well, that we've had is, oh, I shouldn't be because it was only 7 weeks, or I shouldn't be because it was only 17 weeks, or whatever it was. But there's no point comparing your levels of grief. It is totally valid, and it's so And I thank you for sharing all of your own story as well, because I think it's really important for moms also to know that you can really empathize because you've gone through something like this, and you have a deep understanding of what this mom is experiencing.
Yeah, I think, you know, what I learned from this experience and in my practice afterwards, you know, there's different forms. Grief takes many different forms, and everybody grieves differently. And being able to recognize sometimes things that don't necessarily look like grief, but are, and giving people, like you were saying, Johanna, about giving people the permission. People shouldn't need the permission, but in sharing and in talking and in doing things like this initiative that you and Lana have put together, it gives mums that understanding that they do have permission to grieve whatever form of loss they've had, even if it was one by choice. It's all, or even if it's perhaps embryos that they still have, all of it is forms of grief. And if we can support each other, it is very helpful. I must say, you know, finding that support from practitioners, but also from mums who've been through the same thing, was very profound. Going back to practitioners, another thing I wanted to say to mums who might be suffering with this is choosing your practitioner is important. Not everybody has the same rapport with every other human. And it's understandable that we might not necessarily have a rapport with every practitioner. And so finding the practitioner that you feel gels with you, that is aiding you in your healing journey, is important. And if you feel that, you know, that modality of treatment or therapy or even practitioner within one therapy is not exactly working for you, don't be afraid to change. Because in our practice, for example, Anna and I are very open with that, but also I have, you know, like Mark was saying about sharing between practices, you know, having a bank of people that we can recommend to our patient, whether it's therapy or doctors or other modalities of treatment, just being able to find the right therapy for that patient. At the end of the day, that's what we want. We want our patients to be in the right place for their healing.
Yeah, that's really important. And that's part of the reason why we're doing these coffee mornings, because I think it's so important to get a feel for the individual practitioners. And obviously seeing you live and talking to our moms this morning, they get a much better feel than just by reading a biography, you know, so.
Yeah. Sorry, I'm just changing the slide of my baby.
Amazing.
Yeah, that's any questions I'm happy to answer. Or if anybody wants to, you know, reach out, you know, on a level of grieving on a personal level, you know, that's also okay.
Yeah, amazing. We've had 2 messages in the chat. We've got my lovely client, Patricia, who says, sending huge hugs to everyone who has grief and loss experience. And thank you for sharing this with us. And then we have a question for you as well on osteopathy, which is not related to loss, but this mom has a newborn with a tongue tie and he is latching, but it's hurting her nipple. Our pediatrician recommended to do the cut, but we also had body work can help. Can osteopathy help with that? Or would this be something to do in combination with the surgery or when the surgery has been performed?
Okay, with this, we'd have to see the baby to be able to assess that exactly, to give a more precise answer. But yes, definitely, this is something we deal with. Body work is super important with ties. But very often we would work in conjunction with the pediatric dentist who's doing the release, doing the body work before, sometimes oral work before the release, body work before and after the release, of course, oral, both of them before and after. And we may also work together with a lactation consultant who would help with that positioning and nipple and the difficulty. Although the baby's latching, breastfeeding shouldn't be painful. So yeah, the body work is where I come in, or Anna and I come in that particular situation.
Really good. Amazing. Thank you. And yeah, Phoenix Park, very centrally located. So yeah, go and see Sarah. They're a really lovely clinic and you'll be in good hands there. Amazing. Thank you, Sarah. Thank you for sharing your screen. We're moving on to traditional Chinese medicine now. Very excited to hear from Mark. And I shall be sharing my screen, which is playing up a little bit today, but let's hope. Where is my presentation? There we go.
Okay.
Great.
So I'll start. Yeah.
Go for it. Thank you, Mark. Thank you, Sarah.
So yeah, Johanna, thanks for inviting me over. My job here is to share about how TCM can help or cannot help. And today I'll just be covering 3 condition labels that people come in for. The first is when they feel like in the first trimester they're bleeding or there's lower abdomen pain, a little like what you might have during menses, and that's a threatened miscarriage. It's kind of curious and important to know how we might be able to help because it's seldom spoken about. So this could be anywhere between 6 and 10 usually. And some women just continue without too much intervention, apart from 2 things from their OB. One is Dufaston, extra progesterone, and the second would be bed rest. But some women do come in, and when they do come in, we do 2 things. That would be we give acupuncture. I perform a certain protocol, and it's common in Chinese medicine. And the second thing, which is a little scary for some women, but with consultation, many agree to that. And that's also curious because we're going to talk about that later. And we have had good results in helping with threatened miscarriage. The next thing is fetal growth restriction, which is actually part of threatened miscarriage, in that the embryo or the fetus is not growing as it should. And normally we get FGR cases closer to the trimester. And again, with some consultation, patients do take a leap of faith in trying out herbal treatment. And again, I find it very useful. So you can see a fetus at maybe 5 percentile moving back into the 20s or 30s with herbs. The usual concern by the parent is, what is this stuff we're eating? So I'll explain a little later, okay? And Johanna, if there's any question, just ask along. I'm just using this as a way to talk, yeah? The second, yeah. The second thing is that people always ask about is post miscarriage recovery. So what happens most times is, let's say there's an incomplete miscarriage, meaning at whichever stage the products of conception do not completely expunge. Then women might come in and ask, hey, I don't know if you can help, but I have an incomplete miscarriage. So usually what happens is I give a treatment that I otherwise would have given much earlier. Sometimes it could be 3 months in. So most times we can speak a little about this. Let's say in the case of say an 8-week miscarriage, the woman is usually devastated and would not have been a frame of mind. Sometimes they come because their friends say, please go and seek some TCM treatment, and then do they come, but most times, no. Now, why would it be helpful to come? Number one is because during this stage of post-miscarriage, I would say that going to seek help from someone, despite feeling that you are okay, is very helpful. This someone could be an osteo, someone to talk to, a good friend, going out on a social with some friends who would listen to you, an acupuncturist, whatever, you know, it can be really helpful. The second thing is that it's usually sort of preventative. It prevents incomplete miscarriage, and while most people successfully complete it, it can be useful with some support. In other cases, the woman might, so the decision is always very subjective. I just had a patient come in. She says her previous miscarriage was very smooth, and therefore maybe she would pass on supportive treatment for 1 week. And if that weren't to work, and that maybe she would come in to get some support in the second week. Another reason why people might come in for TCM support post miscarriage is when sometimes they decide they don't want to use mifepristone, misoprostol, Cytotec, because it can be a little harsh. And these are the people who are okay with doing needles, and we'll do acupuncture, and it is very helpful. In the same way, it can be very helpful for post dates when you're not delivering and it's already 41 and a half or 42 weeks, you know? Okay, maybe if you move on to the second slide. Thank you, Johanna. So these slides I just put together so I have something to talk about. More than 20 weeks, please seek out someone like Path to Motherhood. I'm not too familiar about working with stillbirth at the physical level at all. But you can see below IUGR and FGR, it's like basically if your baby is a little low in weight for stage, seeking a TCM can be helpful. Okay, so it's just not me alone. TCM have been doing FGR treatments since I don't know when. It's just that people are a little more careful now using herbs during pregnancy. If you look on the left, we're talking about miscarriage, first trimester, early pregnancy loss, and threatened miscarriage, which I covered earlier. Yeah. Johanna, could you move to the next one?
Sure. I just want to say as well, you know, mums are often, or practitioners, doctors are often a little bit reluctant to send people to take herbs. But the reality is because we don't have data on it. There's not the science behind it. TCM works on a vast, you know, years and years, millennia of anecdotal evidence. And there are, I'm sure, enough studies in China actually to show that these herbs are quite safe to take, but it's not something that mainstream medicine has necessarily embraced. But I guess this can be really, really, really helpful for a lot of moms. So have an open mind is what I'm trying to tell my clients. Yeah. Okay, sorry to interrupt there.
That's useful. Thank you for saying that. Yeah, this slide is easy, good to talk using. So the issue with a miscarriage these days is that I see many cases where there is a tendency towards inaction from the OB versus you could think of it as too much action, too much testing. And maybe it's the the people I see where, you know, you have one miscarriage the first time, and then you're like, okay, it's a one-off, and then you have it again. And I feel like, just based on the people I see, when you have it again, it's good to know that, hey, we should just test you should do a biopsy on the uterine contents. And it may be helpful to pay for it or go through the trouble despite grieving and having a hard time emotionally. Because I feel like sometimes with the OB, it's also very, it's a sensitive situation. And I feel like sometimes the patients are left to say, wait for miscarriage to happen, and then and maybe not collect the contents, not to be too graphic, and in which case you lose an opportunity to discover why. Okay, so many patients decide, and maybe Sarah could weigh in on this, or even Johanna. Many patients decide they don't want to go through the mental taxation of figuring it out. And usually it's after trying again for your number 3, at least in the people I see, and then not succeeding again, where they decide this is too draining. I tried to have a baby, I conceived, and then same pattern, same week, I get that thing happen. It's so anxiety provoking, you know? So just putting out there that it is very useful to know that it can happen, and there are a few things that you can possibly do based on what little I know. Number one is to speak to your OB about it, and even if you have not had a miscarriage, if something were to happen, how are you going to manage the miscarriage with me? Okay. Can we do testing, or am I being a little too, what's the word, paranoid, and want to do testing despite the tendency that the possibility that this is just a one-off? The second thing, and this is more important for, I guess, age related, okay, especially for first time wanting TTCs. Can I do karyotyping blood testing before we try next? Okay, because when we do karyotyping, we can check parentals. That means not just the mom, but the dad, because both will be contributing chromosomes to the embryo. And then, sorry, this is not too natural, but I think it's important if, the patient is just looking at all means to conceive well, okay? So secondly, I might suggest, and some people are not so open because they might want to have a natural birth. Like, okay, if you do consider IVF, you have another chance at testing. You can do a PGS or PGTA, which will give another test. And then after that, of course, you do your CVS and your amniocentesis to test again. Okay, so that's 3, right? So one is pre-trying, or when you're trying. One is during the IVF choice of embryo. And one is between 10 to 15 weeks, whatever test you decide to do. So I think that's important to know. And the second thing which relates to just karyotyping or chromosomal testing, same thing, before you even conceive. It is important because you may have balanced translocations, which basically means your embryo may be chromosomally normal. It has 23 plus 23, but there may be balanced translocations, which basically means some bits that are not too normal, which may predispose to certain issues, for which you can do a PGT-SR testing, which basically, if you're doing IVF, goes and looks at the embryo for these minor anomalies. And if you're really, if you're you're trying the third time and you have already had 2 miscarriages, I think it's so important to be testing, and if you can afford it, to be putting this extra effort, because the pain of losing it again, having tried for like, I don't know, 8 months or a year even, is usually really bad. People just feel so devastated. They don't want to try. They take 6 months off. They don't want to come to treatment. It's so stressful. Okay, I think I said my piece on that. Is that okay?
Will you go into how TCM sees this, or how TCM supports?
Okay. Maybe if you go back, this is not so important. This slide, sorry. If you go back to, this is about threatened maybe just go to the previous one. Okay, so let's use this one. So if a person has threatened miscarriage at say week 8, okay, bleeding, pain in the lower abdomen, she's anxious. There's certain things you can do. You can use the most common thing, and even the OBs are yes and no on this. Like, okay, we're just gonna basically spam you with progesterone, yeah, oral progesterone, rub-ons, pessaries, everything. And it has been proven helpful, but some research says maybe not. And then for the patients who are open to, I would say acupuncture, I do a protocol, and other people have protocols to protect the fetus. Yeah. So the common questions would be, hey, does this help if the fetus is aneuploid? Or does this help if this is selection of the fetus? Then the answer is no, because if there's chromosomal abnormality, then maybe acupuncture may not help. But this is where I feel like it can be kind of useful. So there are situations where, because of chromosomal abnormalities in the parents, either the mom or the dad, there can be a tendency toward clotting disorders. Okay, and this is where I find the Chinese herbs or acupuncture may be useful. So these Chinese herbs that we use for protecting fetus, some of them are used for back pain. Okay, some of them are helpful in pain relief. And I mean, there's not research on this, but just from use alone, I find that the herbs that help with fetal growth restriction or threatened miscarriage somehow help with microcirculation, this capillary circulation. There's no evidence on this, but I feel like that is the biggest, that's the most likely reason. And it does relate to cases where there are undetected clotting disorders. So let's say you have a second trimester, this is your second miscarriage, and then you'll be thrown to do a barrage of tests. Okay, the first set of tests would be autoimmune. It'd be ANA, SS. I can't remember, SSBO or something, and the other bunch of them would be actually on clotting. They could be APA, ACA, factor 5, factor 2. So these are just like top of the line, okay, covers. And if you test positive on any of these, the Western intervention would be to use steroids. What's the other thing? They use IV lipids to suppress your immune system. And if it's a blood clotting disorder, they would use at a low level aspirin or heparin. Now, there are cases where the woman doesn't test positive for any of these top of the line filters, but then when you look at the, what's the area? The area between where mother blood and placenta blood meets, it's very clotty upon passing, right? And this is where I feel the Chinese herbs somehow help with placental blood flow to the fetus or the embryo.
Can I jump in here with and say here, with the loss of my last baby, actually, it seems that it could have been a clotting issue in the placenta. Yeah, we did a test, and then I went for all sorts of blood tests and so on. And it seems that, you know, something like that. And I was prescribed aspirin and I didn't take it. So yeah, yeah, I hear what you're saying. That's something that perhaps could have helped me.
Yeah. So I think this area is advancing, at least not on the Chinese medicine side. I mean, there's one situation I heard of where, and this was a choice made by an OB who would otherwise have been like sort of like expelled from his community, because he was using high dose heparin on someone who did not test positive for any of these, and she knew it was a risk, but she had multiple miscarriages and she had a successful pregnancy there and then. And it's an exploratory form of treatment. The same way, you know, like when people come for herbs, it's always exploratory, right? But I guess my thesis here is that somehow we're helping with microcirculation, placental blood flow, and do consider using Chinese herbs if.
Yeah.
Yeah.
Amazing. Moving. Okay. Oh, we already talked through that.
Yeah.
Yeah, and then can you talk about maybe what do we do after miscarriage, after a stillbirth? How can how does Chinese medicine support that? Okay,
so I guess after pregnancy loss, people come in, and in the end, it's the relationship, right? Right, like Sara is saying. So if the person feels connected or supported enough, the most important thing I feel is, okay, it could be an acupuncture session, it could be a craniosacral session, it could be an osteo session, but the person feels safe, and I guess that safety is so important. Whatever we're trying to do, okay, the first thing we're trying to do is, of course, downregulate the nervous system, take away from fight, flight, or freeze. The second thing that is more on the herbal end of things would be just enhancing microcirculation in the lower abdomen, in the pelvis. And this is what you might call doing a mini confinement. You'll be using herbs that enhance circulation. And then after that, we'll be adding on herbs, as always, in a confinement from the second week onwards, to just rebuild the system and to prepare for whenever the woman is ready for the next TTC attempt.
Okay, amazing. Thank you so much. Sorry, is there anything else we need to talk about on this slide?
Nah.
Okay, amazing. Thank you. We're actually right on time. So that's always good to see. Very happy to have had you on the call, both of you. We will be sharing the details for your clinics as well. We had some questions in the chat earlier about that. So we'll be sharing that with our participants, and I'll be sharing the video with you later to share with other clients as well. Thank you so much, Sarah and Mark, for joining us this morning, and thank you for the moms as well who were on the call.
Thank you.
Have a nice day. Bye.
Thank you, Hannah.